Good day, everyone. My name is Matlaku. I'll be taking you through the index testing modality training. You could remember that HIV, even though it is not well spoken about these days, but it is one of the diseases that are burdening in our healthcare institutions. Therefore, I'll be taking you through this modality because it's one of the modalities of which the National Department of Health has come up with, trying to alleviate or to find the case to find the new HIV infections of the people who are positive, but then they are not taking their medication very well. Like I said, I'm Matlaku. Uh, just like any other program, it also has the standard operating procedure, whereby we need to follow these guidelines so that we are able to achieve the goals that have been set by the National Department of Health. So for us to implement this, we have to follow this standard operating procedure for index. This is the latest one, of course. The main goal of this training is just to build capacity for all healthcare providers to provide index contact testing services effectively, because we all know that we hear about these things on the corridors, but then we don't really know how to implement it. So after this training, you'll be able to do index. Okay, just like any other um, training or classes, one can say. By the end of this training, the participants, which is you learners, you must be able to describe and explain the concept related to index testing, and then you must be able to discuss the importance of high yield case identification modalities, including index testing services. When you're talking about high yield, we are talking about the positivity rate, because we find that most people they are coming for testing, but then we are testing the wrong people. There are people out there who are still transmitting the disease of which they are having HIV positive, and then they are not even aware. And then, of course, to identify the opportunities for index testing in all community and health facility service points, because we know that in South Africa we are having the facilities. Facilities we're talking about our PHC and the hospitals, where we find people who comes to the facilities to seek for medical help. But then even in the communities, we go out there, we reach out to those who cannot access the healthcare facilities, the communities such as whereby they are far from the health facilities, and then those of which they don't know, one can say, about the health facilities. And then lastly, you must be able to demonstrate the understanding of the steps on how to elicit the contacts and solicitation of partners linked to index client. Okay, I hope you are all following. HIV index testing modalities. Okay, firstly, we'll be talking more of provider initiated testing and counseling, which is PICT. Its definition is provider initiated testing and counseling is HIV testing services that are routinely offered in healthcare facilities. You could remember that everyone that come into the facility, according to National Department of Health, they should be tested for HIV so that we can rule out HIV and then be able to know what we are dealing with. Okay. Of course, this one, it is whereby a healthcare provider encourages the clients to test or to know their status by testing HIV. And then we also know we have another modality called index case testing, whereby the healthcare providers offer HIV testing to everyone exposed to HIV by the index case. You could remember that everyone who's exposed to index client, we are talking about index case, one can say, whereby somebody is HIV positive, and then healthcare providers, either their sexual partners or their children, their biological children, they also should be tested so that they can know their status. And then number 3, we are having the mobile testing, whereby the healthcare providers offer HIV testing in the community through mobile vehicles, gazebos, and etc. Remember, I told you earlier that healthcare services, they can be rendered in the healthcare facilities and also in the communities. Here we are talking about the mobile, the mobile clinics that go to the communities of which they are far from the healthcare facilities. And of course, by going to the communities or the shopping centers, whereby they plug their gazebos so that people, they can know their status. And then again, self-screening, which is a process in which a person collects his or her own specimen. It can be oral fluid or blood, and then performs the HIV screening and interprets the results either alone or with someone he or she trusts. Remember, now South Africa has moved to that era whereby they are empowering their patients by giving them the self-screening, meaning they are screening themselves at home, and then they provide us with the results at the facility so that we can be able to give them the medication. Either when they are negative, we give them PrEP so that they don't contract HIV in the future. And then we are also having the social network testing. This is just a recruitment strategy for reaching and providing HIV counseling, testing, and referral services to persons who are unaware of their infection, but using social network connection to locate the individuals at the highest risk for HIV. So basically here, I'll give an example for those who are utilizing drugs, especially the people who inject drugs, because of they'll take the same syringe with different people, and then if that person is HIV infected, they can spread the disease among themselves. Therefore, here we'll look for one, and then that person will take us to that pack, to the pack, one can say. For instance, if maybe we are having those people, in the layman's term, they'll be like the Nyaupe boys on the streets, right? If we have one, then we know that we have to persuade that person so that they can give us their network, and then we go there. It is also called the targeted testing. All right, I hope it's clear. So HIV testing modalities, where can these modalities be provided? Like I said, it can be at the community service points, meaning at the gazebos. If maybe there is a mobile clinic in the community, that's when you can get these modalities. Or at the facility service points. You know that at every facility in South Africa, there is a designated area whereby these people, they can be able to get the services. And then who provides these services? All healthcare workers, from the HTS counselor, those who are trained, and then of course the professional nurses, enrolled nurses, and then enrolled nursing assistant, and of course even the doctors, they do this. Right. So we just have to refresh our memories on HIV 101. Basically, HIV 101, it simply implies that the basics of HIV, So who can name 3 modes of HIV transmission? Or should I pick for myself? Because of, I believe for you being in this class, you must be knowing this. It's a prerequisite because of, remember, this is just a modality that falls under HIV. So firstly, one needs to know about the basic host, and I assume you all know about it. So number 1, who can name the 3 modes of HIV transmission? Yeah. All right. For the sake of time, I'll just tell you about them. You can also remind. I'll be reminding you about them. Okay. Firstly, we know that you can get HIV through sexual intercourse with somebody who is HIV positive, and then if maybe, for instance, another one, you are utilizing drugs with somebody who is HIV negative, and then it can also be transmitted from mother to child if the mother's viral load is higher, or if the mother doesn't take the medication very well. Number 2, name the mode that contributes to the highest to the highest contributes highest to the transmission. Okay, listening. Obviously, most people, they will think it is through sexual intercourse with somebody who is HIV positive. Right. Yes, that's correct, because obviously most of the people, they get transmission through that. Yeah, here and there for those who, from mother to child, but then it is minimal. But then according to the statistics of South Africa, sexual intercourse with unprotected sexual intercourse with somebody who is HIV negative is still the highest that contributes to the transmissions. Hence, they come up with this modality of index testing services. So number 3, the question, just to refresh you, name the most successful HIV prevention program in South Africa. Others will think of, mother to child transmission prevention, right, which is now called the VTP, which is vertical transmission. You can remember that vertical meaning from the parent to the child. It's either from the mother or the father, then lately to the child. So, but then according to the statistics, remember, these things are data driven. One can say they're based on the data. But then here the answer is the condoms, is the most prevention method that is being successful, because of most people are utilizing the condoms. Why are we saying that? Because of the condom distribution from the facilities, either private or public institutions. Right, I guess now we are on the same page. We are all refreshed, right? Okay, let's continue. Index testing. What is this index testing? Index testing basically is just a voluntary process whereby the client agrees with the healthcare provider to list their sexual partners, or their injecting partner, or their biological children. So what is an index client? Index client is an individual that is newly diagnosed with HIV positive, or an individual who is enrolled in HIV treatment services. Remember, we said here we are focusing on those clients that are positive, which are the index client. And then what is the index contact or offshoot or a case? This is a list of the sexual partners or injecting drug partners within the past year, or number 3, the biological children exposed to the index client. Remember, the index client is the HIV positive person, right? And then the index contact are the sexual partner of that infected person, the newly diagnosed person. So those are the contacts. Those are the people that we want. Those are the people that we want for them to know their status, so that they can be given the treatment. Like I said, index testing is just a voluntary process whereby a counselor or a healthcare provider asks the index client to list their sexual partners or the injecting partner, or also the biological children. Why the biological children? Because of, like I said, we know that HIV can be transmitted from the parent to the offspring. And then, of course, all index testing must meet the 5 C's, which are to be consensual, meaning they must be informed, consent, and then confidential. Obviously, we know that in healthcare services, we don't just do as we please. Rather, we don't divulge other people's information. Okay, and then correct results, they must be given the correct results. We must make sure that our test kits are viable and then to use. Okay, and then connection to treatment or prevention services. Okay, with this, obviously those who are HIV positive, they must be linked to care, meaning they should get their treatment. And then prevention services, if those who are HIV negative, they should be given PrEP for preventing this HIV, or they can be given the condom so that they don't contract the disease. And then if the index client agrees to list this partner and the children, these partners, they need to be traced so that they can come to the facilities, or we as healthcare providers will reach out to them at their community level. And then they must also be informed of the national testing campaign and the benefits, of course, and then be offered HIV testing services. All right, so that they can be able to know their status. And then who should be offered index testing services? All the HIV positive adults and adolescents should be offered this index testing services. Remember, we only offer index to those who are HIV positive. And then index partner testing for all sexual partner and injecting partner from the past year. Like I said, the sexual conduct sexual contact should include all the persons they have sex with, even if those who have had one night stand with, and then even if they always use condom with this partner, because we know that sometimes people, they say they use condom, or even the condom may burst. Okay, and then similarly with the needle sharing contacts, like I said earlier, including all the people they have shared the needles or injection equipment with, even if it was just one time, or even if they have cleaned the needle before sharing it, because we know that if we can clean using the water, that thing, it cannot be sterilized, meaning it cannot be free from infection. So of course, like I said, for biological children, the family testing is needed, especially those who are less than 15 years of age, because they are still the minors. The mother who is HIV positive, or the father who is HIV positive and report the child's mother is positive or deceased, or her status is unknown. Remember, if the parent, we don't know the status of the parent, but then in interest of the child, we must be able to advocate for that child according to Child's Act, that anything that benefits the child, it should be done. Okay, or the biological sibling who is HIV positive. Remember, we are having the orphans. We might find that the siblings are positive, only to find out that they got the disease from their mothers. Partner elicitation and testing is not a one-time thing, but should be offered continuously. You could remember that index testing services, we need the sexual partners, right? So partner elicitation is not a one-time thing, because of people, they change relationship more often. Okay, so every time you meet with the patient, you still ask the patient about if they have changed their partners. If not, then we continue with the counseling. But then if they have changed their partners, it will be very crucial for them to list that partner, so that we can be able to diagnose that patient, test that patient, so that they can be on treatment. All right. And then consideration for offering index partner or family testing. Who should offer index testing services? Elicitation can be done by an STS counselor, a nurse or nursing assistant, a linkage coordinator, a patient navigator, or a case manager. Like I said, every healthcare providers who are doing the HIV testing must be able to do the index. And then also the individual who receive training how to conduct the index testing services, such as the home the CHW, the home-based carers, those who have undergone the training of HIV testing services. Where should partner or family services be offered? At all facility-based HIV service delivery points, e.g. may be co-located VCT, which is voluntary counseling and testing, in the ANC, in the antenatal, and then of course even in the TB wards, because we know that TB and HIV, they go hand in hand. Most of the clients that are having TB, most of the clients rather that are having HIV, they later develop TB, because we all know that HIV weakens their immune system, so they are becoming susceptible for any other opportunistic infections such as TB. And at all facilities-based HIV treatment sites, meaning your PMTCT, which is prevention of mother to child, and then ART and etc. And as part of all community-based testing programs, like I said, at the home or at the mobiles. Okay, I hope you are all following. Okay, what is index? Because of today, it's all about the index. Okay, the household testing, we test everyone. Basically, household testing, it's when they test everyone in the household of the index partner. Okay, meaning everyone should know their status. It can be the mother and whoever who is voluntary to do the test. And then index testing services, we focus on offering HIV testing to everyone exposed to HIV by an index case or a client. We test other household members if they request for a test. Remember, we have to give health care services to everyone who seeks it. Okay, like I said, this is just the hierarchy, the sexual partners in the household, and then those if the patient is sharing the needles, and then the biological mothers, especially if they are under 15 years of age, like I said, and then even the biological children, of course. Yes, you can see the arrow in pointing the children. And then again, we are also having this other thing called reverse index, whereby the child comes for EPI, and then you find that the child has the acute infections and symptoms of HIV. Maybe the child is having the shingles and all that. That's when we test the child, and then you find that the child is positive, and then we have to index the mother. Why are we doing that? Because we find that the child got the infection through breastfeeding. Okay, I hope you are all following. How to prioritize index testing services. Notably, sometimes we may have more index cases than we can trace with our existing personnel. What we are saying, because of most people, other people rather are having multiple partners, so we can have more existing. Right, and then suggestion for prioritizing which partners or children to trace first. Index client on treatment with unsuppressed viral load. For those who are taking the treatment but then they are not taking their treatment very well, they must be a priority. Why are we saying that? Because we know that if you are having a viral load that is unsuppressed, so basically you are highly infectious, you can be able to, one can say, to transmit the disease to other people. The index case, which is in an acute phase, for those who have just got the infection but then they are not aware, or they are newly diagnosed, or because they are failing the treatment. Index case and the partner is pregnant or breastfeeding, like I said, to prevent PMTCT. And then index case of partner in an adolescent due to their high rate incidence rates. We all know that they are adolescents, they have high sexual drive, meaning they're sexually active, and then most of them peer pressure is highly influential. Therefore, condom use is minimal, because we find that they are dating people not of their age. Okay, so they cannot be able to, one can say, negotiate for condom use. And then in index case reports high risk of sexual behavior. Those people that come to the facility and they tell you that they have multiple partners, they should be prioritized. And then those who come for PEP, that they hardly utilize the condom. Okay. And then, like I said, multiple partners, age gap difference between partners, especially for young adolescent girls. All right. Index testing, HIV index testing scenario. Okay, this is just a scenario whereby this is an index client, and then he's having a partner and a partner and a partner, and that partner has a partner and a partner, and that partner has a partner. So you can see how the sexual connection, one can say, it is happening. So therefore HIV is still the prevalence, as one can say, because of people are they are still having sex, meaning they reprocreate, right? Okay. And then facility community model for index testing services, and then facility-based index testing. Counselor talks with the index client and then gets the names of the contacts and the information and the biological children, of course, and then decides how will confidential info be shared. Remember, we as healthcare providers, we also do the home-based visit, therefore whereby we take the health services to the communities and to the household. Then basically here the counselor or the healthcare provider provides offer HTS to people linked to those who are living with HIV. All right. Okay. Traditional and assisted contact testing. That one is the traditional, whereby we know that they come to the facility and then we test them, or we go straight to their home and then we do the testing. So we are also having in index, we are also having the options of notifying the partner about the HIV testing. Of course, like referral, here basically you are just telling your partner. For those who are HIV positive, they tell their partner, they disclose to their partner and encourage them to come to the healthcare facility so that they can do the testing. Or we are also having the mutual agreement whereby the counselor and the healthcare provider works together with the patient so that they can be able to one can say, to reach those partners, the sexual partners of that patient. For instance, they will have the time frame, maybe the 7 days or a week, but then you don't wait for that week to end. During the week, you call, you still notify, you check on the patient, you consult the patient. Do you understand? Yes. And then we are also having the provider referral. If you could remember on the third slide, we said provider referral basically is when the healthcare provider initiates the process of HTS, whereby they encourage the clients to come and test. So in this case, we are having different methods whereby it's either at the communities, for instance, the client, it's one can say Omakwapeni or the side chick, but then they cannot disclose, they cannot let their partner come to the facility. Rather, they will encourage the healthcare providers to visit that person, and then dual referral, whereby the client is unable to disclose, but then they need the support. They come to the facility with the partner, and then the healthcare provider give the support while disclosing. If maybe the partner has so many questions, the healthcare providers, because of they have a vast knowledge about HIV, they can be able to answer to the questions. Yes, what is the difference between the passive and active model in index testing? Okay, innovative assistant HIV partner testing approaches. Obviously, like I said, the mutual agreement whereby the client and the healthcare provider, they agree that after a certain time they will come. Basically here they must have a time frame. Provider, I did touched on it. All right, I won't go through it, but then obviously I'll share the slides for you to remind yourself. Even with the dual referral, I did mention that. Okay. And then household testing versus index testing. So the differences between household testing and index testing: basically household testing, we're testing everyone in the household of the index partner. For instance, we come to your home and then we test your partner and your biological children. Obviously, everything in the Department of Health that we do, we must also report it. So for reporting, only count the index tested in the household and the community who had known exposure to the index client. We only count for those partners. It might be the sexual or the what's name, the children, the biological children. And then the mobile community testing person who have not have been exposed through the index case. Obviously, if you go to the community, you might find that you are targeting somebody, but then even the members of the community, they will feel that they should know their status, and then they come and test. How can this be done? Obviously, we are having the steps on how to approach it. Basically, it's just the summation one can say of what we have explained, but then this is a stepwise process. This is what you need to follow. First one, you introduce index testing services to the client during the pre-test services or the PMTCT or art visit. Remember, you have to introduce that in the Department of Health, we're having this program. This program, its main goal is just to cut the chain of infection. How can we cut the chain of infection? By listing the sexual partner so that they can know their status. If they are positive, they can be on treatment. And then step number 2, we offer the index testing services. Obviously, it's a voluntary services to all client testing HIV positive, meaning we don't force you to do that, but then it is advisable for one to do index so that we can be able to cut the chain of infection and to prevent the reinfection of the disease. Step 3, if the clients accept, obviously we have to obtain the consent and inquire about their partners and the biological children, of course. And then step 4, we obtain all the list, needle sharing and biological children. Like I said, we know that all the contacts, they need to be listed so that they can be reported. Okay. And then step 5, we conduct an intimate partner violence risk assessment for each partner. We also do the intimate partner violence because of you find that other people, they are in an abusive relationships, so we also need to screen for that. If there is any, we can be able to refer to the social workers or to the psychosocial support. Right. Then on the next slide, step number 6, determine the preferred method of the partner notification or child testing for each name. Those partners that I talked about, the client referral, mutual agreement referral, and provider referral, and of course the dual method. The client is the one who should choose from that. And then step number 7, contact all the name partners through their modes of notification so that they can be able to know their status. Number 8, we record the outcome of the partner notification and the family or community testing, of course, for our own records as department, and then for continuity of care. And then number 9, we provide the appropriate services for children partners based on HIV status. Like I said, if they're positive, we put them on treatment. Negative, we link them to prevention services. And then lastly, number 10, we follow up with the client to assess any adverse events of the index testing, because of sometimes you list your partners and then after that's when GBV start or IPV start, and then that's when we have to follow up and then check what happened, what has conspired after we have done this exercise, so that we can be able to refer. All right, and then just like any other program, we're gonna focus on the benefits and the principle. Okay, firstly, we're gonna start with the benefits of linkage to care. Obviously, we have to empower to make personal decisions about the health from information given. Obviously, when we give the information, we are ensuring that our patients are empowered so that they can be able to make the informed decisions, and of course to receive the support and encouragement, increase health seeking behavior and a healthy lifestyle. Like I said, we refer accordingly. If maybe the client is not healthier, and then we refer to the dietitian. All the multidisciplinary team are involved, and then of course to empower to develop own care plan, which includes being able to demand quality and comprehensive care, because of that if they always say that knowledge is power. So if people they have knowledge, therefore they will be able to make informed decisions about their health. And then principle of partner services is also client-centered and focused, meaning it is not biased, and confidential, meaning everything that we talk about or we discuss with the patient, they should be remain confidential, unless if maybe uh, an authorized person, we need to refer this patient. That's when we can tell, we can divide the information for to allow the continuity of care. And then voluntary and non-coercive, basically we don't force people to do the services, but then we inform them so that they can make the right informed. And then they are free, meaning they don't have to pay, since well in South Africa the healthcare system is very free, especially at the PHC level. So we are becoming non-judgmental. As a healthcare provider, you shouldn't be judgmental because somebody has multiple partners or somebody's a sex worker, because of in life there are a lot of circumstances that lead people to do whatever that they're doing. And then culture, linguistically inappropriate. Remember, we have different cultures and backgrounds. So others, they believe that utilization of condom with your partner, it's a sign of disrespect. You have to understand that, but then you provide the information. And then they should their healthcare services, they should be accessible and available at all times. Hence where, since well the Department of Health has come up with a mobile for those who cannot access the healthcare services rather. And then comprehensive and integrative, meaning the patient, if they come for STS or for HIV testing, we should also check also the psychosocial maybe issues. If there are any, we have to integrate and refer to the psychosocial support, meaning we give it to the social workers. And then from this information, of course, you can also get other information from your WHO or South African HIV guidelines on self-testing, and then notification supplements to consolidate guidelines on HIV testing are available on this link. And then, of course, from the CDC, the recommendation for partner services programs for HIV, here's the link if maybe you want to read further so that you capacitate yourself more, because of that being a learner, you should be better than myself as your facilitator or as your teacher or as your lecturer. So you can keep abreast with the new developments that are happening in each program. And then you may also contact with the HIV tracing in Canada. This is just the articles that you can go through so that you can stimulate yourself and your mind. So basically, in summation, is that that everyone who's HIV positive, we all know that it starts with the case finding, which is positive, and then they are eligible for treatment. We give for treatment, and then if it's a child living with HIV, obviously we have to consider disclosure and all that. Make sure that we also trace their parents, and then may ensure that their parents, if they're positive, they have to be on treatment. And then again, this is just a cascade. Those people, they should be fast tracked, they should be on treatment immediately or the same day of the diagnosis, in line with the 2018 WHO strategy, which is universal test and treat. And then we know that in 6 months time they can start taking their medication outside, maybe at clinics and all that. All right. So we have to encourage people, those who are positive, so that they can be able to take their medication very well. Okay. Do we have any questions? This is the end of my presentation. Do we have any questions or comments? All right. I believe it's all captured. In absentia of questions and comments, we'll thank